So Colleen, how have you treated patients who are struggling with sugar addiction?
So anyone that comes in to SunCloud and has a history of substance abuse and an eating disorder, we like to encourage them to take the Yale Food Addiction Scale in order to see where they're at as far as their possible addiction to sugar and white flour. And based on those results, it's really important to collaborate with the whole team and the patient to see if it's something that they're willing to do, because there is some research behind how someone that struggles with the two can use food as a form of an addiction in this case. So when someone results in like a moderate or a high score on the Yale Food Addiction Scale, we encourage them to limit their sugar. So we don't like to say like there's any bad foods or we want to avoid food, but we just encourage them to decrease their sugar intake. So any food that contains sugar in the first 5 ingredients, we would recommend them from abstaining from that while we see what the results can be. And then this can hopefully create a better relationship with all the other foods.
And then, you know, the other thing that we're assessing when it comes to a sugar addiction is, you know, everybody's at really a different place. We might see somebody who likely does have a sugar addiction and they are working on so many other things that we're going very slow with the foods that we're asking them to limit or take out, or it could be the other way around. That's where truly the individualized approach comes in, and the sophistication of the clinician and the whole treatment team as a whole working together to really understand how far we can push the patient, what recommendations can we make, and when can we make those recommendations.
And that's why individualized care is so important. Every case is going to look different and we have to treat them each as individuals, not just as a group sum. So if someone's not in a place that they can handle, if someone's not available to remove sugar from their intake due to other behaviors that are coming up for them, and the team decides that those are, you know, our primary focus right now, then we just want to take a back seat of that and keep in mind that it's eventually going to be integrated into their treatment plan.